Hiya, do you have an appointment with Dr. Brown for a facial skin analysis? Alright, well, what we usually do is we'll do a face exam. Is that alright? Okay, I'll just put some gloves on. Okay, so I'm just going to have a look at your face with the light, okay? So, okay. Okay, I'm just going to turn your head. This side. What is your facial routine like? Like what products do you use? Okay. How much water do you drink per day? That's good. You need to keep hydrated, so you're doing well. Okay, now I'm just going to do a quick sensitivity test. Okay. So, how did that feel? Alright. Just tell me if it gets uncomfortable. Does it hurt anywhere? gonna write a few notes down. Alright? Alright, before I take any measurements, I'm going to use this to smooth your skin out. Yes, I do know what it's called. Dr. Brown told me it's called a gua sha. Alright, so I'm just going to gently glide it. I think that you are going to need some extractions done. I think there could be other treatments as well. Okay. I'm just going to write that down. I'm going to start on your forehead, okay? Just relax, please. Okay. This is just to see how symmetrical your face is. can have another look with the light to make sure that I haven't missed anything. Okay. Okay, everything looks okay so far, apart from the extractions that you need. Okay, I'm going to pass on your notes to Dr. Brown. Okay, if you just take a seat and Dr. Brown will be right with you. Alright, take care.
Louise, am I in the right room? Okay, thank you. Hello, I am Dr. Brown and I specialize in the face. Yes, just the face. Whole face, nothing but the face. Okay. Alright, good. And so you're in the right place then. Let me look over Louise's notes. Okay, she checked your face. No lumps, bumps, oozing. Okay, great. Great. Matches her notes here. Okay. Asked about your facial routine. Okay. Some sensation tests. Okay, and I can see she did some measurements and I have them listed here. I will just be going over a couple of those with a different tool just to make sure we have the accuracy. You know, it's very important when it comes to your face should anything serious happen. Again, I like to tell people I just recently performed surgery on somebody who had a horse kick to the face, so it all comes down to like measurements and pictures, and we'll be getting pictures of your face as well. Okay, it's all very important. Okay, so yes, you do need some extractions. You can see some of them from here, but trust me, everybody has them. Like blackheads, whiteheads, just irritations, things. Okay, so there's nothing wrong with your face. We're just going to do a little cleanup. Okay. All right. Okay, and yes. Alright, and we're also, I think we're going to do some dermabrasion to your face, not because it's like you have lumpy, bumpy skin. I mean, look at Dr. Brown. Dr. Brown picked at their face as a child, and this is what we have now. So it just, things happen, but we're gonna do a little something to kind of smooth the skin out. I like to call it sanding the face, but it's dermabrasion. Okay, and nothing scary here, trust me. It's just a little. Dr. Brown can't get the pencil on the clipboard. Pardon, Dr. Brown. Okay, just a little. It is kind of like sandpaper. I'll show you. See, it's just this little textured spot here. I'll clean it, don't worry. And it just does a little vibration, okay? And it just kind of sands off the top layer with any dead skin, takes it right off. Nothing like the horse kick to the face type of deal, you know. Okay. So, were you referred here? Did you choose to come here yourself? Yeah, I just like to know the story, so Okay. Yeah, that's reasonable. Throw some gloves on here. And one moment, Dr. Brown didn't grab a light. Okay. Just gonna do an up-close inspection here of your face. Checking the skin problem areas that Louise mentioned to me and listed on the chart. Are you washing your face every day? Okay. Okay. Let's see. I'm thinking I need. Just going to look at some of these. Okay. Yeah, I see like around your nose. There's quite a few. That's common. It's nothing unheard of. And just maybe across the cheeks. Oh. Which side do you sleep on, or are you a back sleeper, or are you a front sleeper? Is that what it's called? Because that could be a cause of the build-up in the pores and everything as well. Oh, you are? Okay. Yeah, I would think the pillowcase is causing some of that then. Okay, so this is the camera. It also doubles as a magnifying glass. So I'm going to first just inspect with the light. It is bright. I'm going to put it in front of your face now and then turn it on. You can close your eyes if you need to. Okay. No, that is my white light, okay. Alright. Okay, I'm gonna back up a little bit. You can open your eyes now if you had them closed. And I'll be taking the pictures. Let me just switch to that mode really quick. Okay. And we're going to do a front and then side profile, okay? Alright, thank you. So, again, doesn't matter if you want to close your eyes for this, it does flash, so that is up to you. But I'm going to do this. It doesn't have to be as close. Yeah, I'm just going to snap them now. Okay. Turn for me, please. Thank you. Other way. Right. Okay, so those have uploaded to the computer just fine. And that, again, just in case anything traumatic happens to your face and we need to reconstruct, okay? Nothing crazy right now. We also do like to take progress pictures as we do things, so. Let me check that one measurement I was a little curious about. I love my job. Please don't question if I do or I don't. This is just my face. Okay, so let's see if that matches here with the I'm gonna have to do some conversions because Louise and Dr. Brown have different measurements here. Yeah. Okay, that was. It's okay. We make the office people do it. Okay. All right, I'll just have them do the conversions for us. But everything should be fine. Just the preliminary stuff, since you are a new patient here. Okay. So we're going to move on to the extractions. And so again, that's around the okay. So just along your nose and your cheeks here, just a couple of spots, okay? I'm going to mainly go for the larger ones, but also the ones that look like they're ready to come out. We don't want to force anything that doesn't want to come out, okay? Okay. My fancy toolkit. To open your pores, though, I am going to begin with some water. We're just going to mist it on your face. I know it's quite warm, it's warming up, so pores aren't going to be that difficult right now, but just wanna help them out a little bit. You don't try to do that yourself at home, do you? Oh, okay. Well, let me tell you. That can cause scarring if you're not doing it appropriately, and then we will have to have a more serious conversation, okay? So just trust Dr. Brown knows what they're doing, and this is probably the safest place to be having extractions done, and not in your bathroom on the counter. Okay, let's see. I'm just going to give your pores a moment here. Dr. Brown is once again having difficulty. There we go. So we're going to do a before wipe down of your face, and then an after, just to make sure everything is sterile and we do not create new acne that will form right Listen, I have a firm hand, okay? Dr. Brown's been doing this for years now, and I mean business. So, no dilly-dallying here. Tools. This does look sharp and pointy. It is, okay. but as long as you don't panic and trust me, things will go just fine, okay? Okay. So what I do with this is just kind of break open that top layer that may be over a blackhead or a whitehead. You mainly have blackheads. Again, everybody's got those. Everybody deals with that stuff. No shame. I see a lot of things in this office, and trust me, this is probably the best you could be dealing with. So I just like to break open that spot in some areas where it doesn't look like it's going to just willingly be extracted. This little doodad, you probably use these at home, or the other ones I have. The other ones, yeah, okay. So it's along the same lines. I prefer this though for the angle and everything, but you just press for a couple of seconds and release it, and all of the gunk should want to just come out on its own, okay? So we're going to just do some gentle presses around, see what comes out, and then we will go around with the pokier tool on the bigger ones that I can see, and we'll get those out for sure, okay? Okay. Perfect. So let's start with this, and we're going to go right here. I'm just going to press, 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 and release. How was that? Okay. Try that again. Press, 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 and release. Just got this in my hand to clean it off. Okay, and then right about over here, we're going to press, 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 and release. Okay, press, 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 and release. You don't want to be too aggressive. You don't want to do too much dragging. The dragging will, again, cause scarring and all sorts if you're a little too aggressive. So, just over here, press, 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 and release. What was that? Dr. Brown has a voicemail. Well, I'm with a patient and I can't listen to that. What was it about? Really? I don't think I need to deal with that right now. Okay, we're gonna try over here. Press, 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 and release. Press, 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 and release. As you can feel, I'm not really dragging this at all, just the press and release, because the pressure of everything around the spot should want to just make it come out. There are a couple though that I'm seeing that do have a layer. So again, just be calm. It's a little poke. It's just enough to kind of break that top layer, but not injure you, okay? Alright. Just a quick little poke. In the nose is where I find this needs to be done the most, so just hold still. Okay, and then I'm going to just take your nose and kind of press it over to the side. I apologize for any dog barks you hear. There's a pound nearby. Okay, same thing on this side, just a little poke. And as you can feel, it just catches the skin to open that area. Don't think I'll need that anymore. We'll see. So now these bigger things should just come right out. Okay, again on the nose, press, 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 and release. Yeah, a lot came out with that. Press, press, and release. Okay. Yeah, this is working. Yeah, so what we're gonna do after, I'll do the quick little cleansing wipe over your face, and that'll help close the pores back up. And then I'm gonna give you a little bit of a facial massage with the ice globes. They're nice and cold, again, helps close the pores and settle everything and get rid of any redness that may come up as we do this, okay? Press, 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 and release. Press, 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 and release. You don't have too many on that side. If you are a face sleeper, like you say, I'm thinking you go this way and lay on this side, and then, yeah. Okay, press, 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 and release. Still press, 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 and release. Okay. Double check the nose. There's just a few more over here, okay. That looks a lot better. Okay, let me get the ones on the nose that I've noticed now. I'm gonna move your nose over this way and press, 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 and release. Okay, again, just press, 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 and release. Press, 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 and release. Okay, that looks really good. Trust me, the extractions are the highlight of Dr. Brown's day, can't you tell? Exactly. Alright, so again, just cleansing a little bit. How are you feeling? Nothing too crazy here. Great. Didn't have too many on the chin, but we'll keep an eye on that. Nothing that needs to be messed with currently. The chin's very sensitive. When you try to do stuff like that, it'll just turn into an actual spot, and we don't want that. Okay. Dr. Brown likes to be very quiet when they do this, so please just bear with me. If you want to, you may feel this on your hand. Yeah, see, so it's just like the finest grain of sandpaper that we're just going to go over your face with. Okay. Alright, so again, Dr. Brown likes to focus. Please just let Dr. Brown focus. Okay, don't move. And we're done with that. See, quick and easy. No pain at all. Use that wipe again and just clean off anything that may be loose on the skin. Alright, see, quick and painless. Just a little vibration Just a quick little freshen up. Your skin's gonna feel a lot smoother after that. Okay, the globes have been chilled and they are ready to go. Okay, just relax now. You can close your eyes again, get comfortable, and I'll begin the massage with the globes. Again, just gonna close the pores up and settle everything back down, the redness, any possible irritation. Yes, I know, it's quite relaxing actually. I'm going to go under I'm going to go along your jaw as well. Just part of the massage, part of the deal. Okay. And along your nose here. Okay. Just quick and easy. The coolness does wonders for the skin. Do you ever chill any of your facial rollers or anything? Yeah, it really does make a difference with like puffiness in the morning and such, so I'd highly recommend it. But that is everything, so if you have any concerns, of course, come back, but as of right now, everything's checking off. No questions for Dr. Brown? Great, love to hear that. And if everything is all good, I hope you enjoyed the rest of your evening, and you can of course come back if necessary, okay? Alright, bye.